Thanks so much for joining us today. We're happy to be able to have the time together to be able to share information about our now successful reentry. Please know that this session is being recorded and will be available on the HRDI COVID website. And today, as we have in past meetings, we'll share the latest updates on our reentry and answer our questions as best we can. You're welcome to pop those questions into the Q&A as we go along, and we'll work some of them in as we go along, and we'll come back around at the end to any others. We also have several of our team with us here on the webinar, and they'll also probably answer some of those questions as we go along. Sometimes it's we find a lot of them are easy to answer by giving you a link, and we'll pop some of those in so that you can grab those, as well as some that we'll share in the chat. So I want to thank everybody for coming together today to get the information that we have to share. I want to thank all of our community for guiding our campus back to a largely in-person presence. We have said what we said we were going to do. We have kept our community safe, and we have returned without further delay to the transformative in-person learning experience that changes our students' lives and helps us build the society we need for all of our futures. We are the safest place to be in Orange County in terms of COVID. And as you hear us share much of that data, current data as we go along today, you'll see that that's very much supported by the data and where we're at as a campus. Give you a quick idea of the items that we'll cover on today's agenda. We'll be talking about the vaccine. We're talking about sharing a little bit of information about contact tracing, President's Directive 22, some those measures that we can continue to do to make sure that our community remains safe, and our testing program as well. So skip down, let's see. Talk about our vaccine policy for a minute. Our vaccine policy continues to be the cornerstone of our reentry plan. That's maintaining the health and safety of our campus. As of today, about 80% of our faculty and staff have uploaded their vaccine record, and those continue to come in. As you all know, the Chancellor did announce a mandatory vaccine policy that will come into effect shortly. Calls for employees to be fully vaccinated by September 30th and to provide the vaccine record to us on the campus. You can upload those vaccine records now. We've been, like I said, receiving lots of them. Again, about 80% of our employees, about 74% of our students. There is an option for a exemption, and we'll talk a little bit about that. We do currently have exemptions on file for about 2% of our community, so pretty low number. We'll talk a little bit about those as well. But you know, I said this is the safest place to be in Orange County. What are we seeing? We have a high vaccine rate in Orange County. We have a testing plan for those that have not yet been vaccinated or given us their vaccine record, or for those that are symptomatic. And we also have a mask mandate. We'll talk about all those pieces today. If you had a chance to read the New York Times today, you would have read that they continue to find breakthrough cases in exceedingly low numbers across the country. The New York Times is finding breakthrough cases for fully vaccinated people of less than 1 in 10,000. And that number is also showing up in the Orange County numbers. If you monitor the Orange County numbers, those numbers have continued to decrease in the last 10 or 12 days now, a pretty sustained decrease in the number of cases. And the breakthrough cases also have been on a sustained decrease. So those things all tell us that we're doing the right things. We're doing the right things, and we will continue to do so. In addition to that, Pfizer is now fully approved, which is terrific. As we did highlight, our community is required to be fully vaccinated by September 30th, or to have one of those exemptions on file that we'll talk about a little bit. Let's go ahead and we'll move down to the exemptions now. To be excused from the Chancellor's policy, you are able to seek either a medical or religious exemption. The process for that is available now. The link is there. We can drop that in the links as well. And as I said, about 2% of our community has sought and been granted those exemptions. Anybody who has an exemption, an approved exemption, is still required to test each week. And that's in the surveillance testing tent that is behind the bookstore. You are required to test every week if you've been granted one of those exemptions. At the same time, if you have not yet given us your vaccine record, you're also required to test each week. And we have already started the enforcement for these policies, both for the vaccine policy with weekly reminders to folks, letting them know that we need to get their vaccine record and that they're required to test. We'll be moving into progressive discipline on the testing mandate for those that haven't been testing. We've employed that already in the mask mandate, and we will do so with the vaccine mandate as soon as that comes into full effect on the chancellor's guidelines. To make that, if you skip down, Arlene, to the next slide, to make this easier for our community, we have arranged another set of vaccine clinics. Those are coming up this Friday and next Monday in Titan Gym from 8 to 5. The county will be doing those. They'll have all 3 vaccines available. For those that have not yet started their vaccine regimen that want to be in compliance by the September 30th deadline, the Johnson & Johnson vaccine will be available. In addition to that, folks are able to come. You can come for your second shot. For those that are now eligible for the booster based on the guidelines, you can come for your booster shot. You all members of our community, you're welcome to bring a friend, bring a community member, bring a family member. Of course, 12 and over at this point, because that's the what's been approved for vaccine. But please share this information with folks. We want more folks to take advantage of that vaccine clinic. The vaccine clinic we had in August had about 500 participants. That's big. That was a terrific turnout, and we're looking forward to similar next week as we go through that. I'm going to turn over now to John to talk a little bit about the contact tracing policy and what you can expect if you happen to cross paths with any of the various groups in there.
Thanks, David. And one more thing on the vaccination clinic. We do encourage you to bring members of your family and use that term broadly. They can park in Lot D. They won't be ticketed. So we're trying to make free parking available. We want this vaccination clinic to be as successful as possible. So please spread the word on that. Regarding contact tracing, Mary Becerra and I kind of lead the university's effort to contact those individuals who might be positive for COVID-19 or be experiencing symptoms or may have been exposed to someone. We receive those reports in one of 3 ways. We get an incident report, and that report is available on the reentry page on its own tile. We get reports from the weekly testing that David mentioned earlier. And increasingly, we're getting reports from faculty and some staff members who have heard that a student, either in their class or who may participate in a club or organization, have tested positive. We want to thank you for raising those reports. And as a faculty member or a staff member, you can file an incident report in the name of that student. We'd much rather have 2 reports for the same case than no reports. So please take advantage of that incident report. And again, thank you for going the extra mile and letting us know about those cases that you're aware of. Once we get one of those reports in any one of those 3 ways, it's collected centrally. It starts over in Mary's shop in the Student Health Center. They're responsible for contact tracing students. Once the students are done, they go over then to HRDI, and we contact trace all of the employee cases. We make direct contact with someone who has a confirmed case or a probable case. You speak to a contact tracer. We get as much information as we can. We also speak with all individuals who've been identified as a close contact. For those individuals who may have been exposed, which is being on the same floor as someone who's positive, those individuals receive an email notice. And in that email notice, it lets you know that if you were a close contact, you would have been addressed already. We give them information about testing resources available to anyone who wants to get tested. So that's just kind of a very quick snapshot of how we address and how we interact with those who are part of the contact tracing process. On the academic side, I know that some of you are staff that work in academic affairs. I just want to also highlight that once we get a report of a positive student in class, We first notify the dean of that college, the associate dean in that college, and the respective department chair. Then we notify the faculty member, and then we notify those students in class. So we have a special process for on the academic side, and it's really worked well the past week and a half. One thing that leads to contact tracing, and that's our weekly reporting of numbers. There's a separate tile on the reentry webpage that highlights the weekly numbers. For the period of August 31st through September 6th, we had 17 positive cases on campus, and we had overall 24 positive cases. You might recall for the week prior, we had 25 cases. So we're essentially had the same result, which is really, really positive. And if you go on the reentry website now, those numbers are updated, and they're typically updated between 3 and 5 o'clock on Tuesdays. So you can look next Tuesday for next week's numbers. David's going to talk a little bit more about when you've tested positive. So David, I'm going to turn it back over to you.
Thanks, John. And I'm going to echo those numbers back to you again. In the testing in the period that ended yesterday in our report to the Chancellor's office, we reported 17 cases on campus. There are about 44,000 of us in our community, about 40,000 students, about 4,000 employees, 17 cases in the last week. Again, this continues to be the safest place to be in Orange County in terms of COVID. For those that do test positive or exposed to COVID-19, there are protocols there for those folks. If you do test positive, we want you to stay home. We want you to stay home. We want you to use your sick time or your ECRL leave. We want you to recover and get better, come back to campus. It's just really important. That's one of those things that we can do to take care of each other. If you test positive, please stay home. At the same time, we know now that about 80% of our folks have already provided their vaccine record to us. For those folks that are vaccinated and are asymptomatic, there aren't any further precautions that they need to take. You are welcome to get tested at any time that you want to at the testing tent there for asymptomatic testing behind the health center. If you happen to be in one of those places or spaces, you would receive, as John described, communication from us. If you're a close contact, a phone call. If you happen to cross paths with one of the spaces where a positive case had been identified, you get an email from us. Don't lend too much to those emails. Take this seriously, continue to monitor yourself, check yourself for symptoms. But if you're fully vaccinated and asymptomatic, there isn't anything else that you need to do. For those that have not yet provided us their vaccine record, again, a small percentage of our community, for any exposures, we would work individually with those folks to address any mitigation measures that would need to be taken. You've seen this slide from us before. Basically describes what needs to happen for those, kind of a flow chart. You know, if you've been vaccinated, you're good to go. You don't need to do the surveillance testing. You're fine to keep coming to campus. Check on yourself, make sure that you're good as you walk out the door in the morning. But other than that, you should feel confident in coming to work. For those that haven't yet given us their vaccine record, you are required to test each week. And we've been following up with you, and we'll continue to do so to make sure that you complete that testing. And that will continue. Either until we receive your vaccine record under the Chancellor's policy, mandatory vaccines, or until you're approved for an exemption under the medical or religious process. If you are approved for those exemptions, you are required to continue to test each week for the duration. Let's see, move on from there. Directive 22. Y'all saw that we did reissue Directive 22 shortly before our reentry to campus. We're going to continue to monitor the situation based on the best science and the best information that we have. We look to constantly for guidance to the CDC and the California Department of Public Health, and very much so to the Orange County Public Health Care Agency, as they're most in tune with what's going on here in our local area. Right now, Directive 22 says that everyone must wear face coverings, must wear masks in indoor spaces, at least until September 30th. And we do plan to revisit that as the case numbers continue to change and the guidance continues to change based on the most recent case numbers. We will revisit that. And we anticipate revisiting that in the next week or two, and to give further guidance what our campus policy will be post September 30th. And so you can expect to receive some follow-up from that as well. Let's see, let's go on to the next. I talked a little bit about personal health screening, but one of those ways that we can keep each other safe is to stay home when we're sick. We are extremely fortunate at Cal State Fullerton to have excellent benefits, including sick time. And so we do encourage you, if you take that couple of minutes before you walk out the door in the morning, make sure that you don't have a fever, make sure that you're feeling well enough to come to work. If you aren't, take that sick day, feel better, come back to work when you've recovered. That really goes for COVID, that goes for the upcoming flu season, that goes for anything that you might come down with. Take advantage of those health benefits that we offer to you, and make use of that in order to keep the rest of our community safe. I think that's all on that. Let's skip down. Here's a couple more resources for you. These are QR codes that you can grab up with your cell phone. If you have your cell phone available, you should be able to point it at any one of those and grab those. This includes our COVID-19 recovery webpage. Lots of information there. Encourage you to just take a look at that from time to time. We have some additional resources on our HRDI COVID website. And we also developed the instructions for a safe return. Probably many of you have reviewed that already, but just as a good reminders in there for those items that we've put out there to maintain the safety of our community. That's the bulk of the information that we had to share today. Let's go ahead and turn to the questions and see if there's some that we want to answer live. Tara, if there's anything that's still lingering out there.
The only question we have outstanding right now is just a question about the upcoming flu season.
Oh yeah, I see those. I know the flu vaccines have just become available. We just got a communication from Kaiser that they're available. Quite a few of our employees take advantage of Kaiser. So you may be able to get those there at your local healthcare provider. But I know that they are coming out more widely. I think I was at Albertsons over the weekend and they had some signs up about flu shots as well. So I think they are out there now. We will be working on some flu clinics to the extent that we're able to. We do have a lot of our resources devoted right now to our to COVID response. I would very much encourage you to look for one of those flu clinics available externally if you're able to. It looks like we made it through the bulk of the questions. Susan, thank you so much for letting us know that yes, Kaiser is doing those flu shots now. That's great. Thank you for that. But it looks like we've gotten through most of the questions. You are always welcome to send additional questions to us. We're available to you. We're happy to look into anything and we very much want and need your feedback. In addition to that, we will schedule additional forums like this as necessary, and we'll communicate with you about those. But know that this continues to be the safest place to be in Orange County. I say that because we have a high vaccine, we have collected the vaccine records from a very high percentage of our community. We have very few cases compared to our community size. And all of that kind of gold level standard plan that we put into place is working. If you're out there around the system, we heard that some of our sister campuses are getting a little tired of Fullerton being held up as the model. That's okay. We are thrilled to have the model system for the model response plan for dealing with COVID-19 and our campus reentry. And so far, our reentry is going very well. And I want folks to know that this continues to be a very safe place to be. And we're really happy to have everybody back. I know our students have been appreciative of it. I'm glad that we're through the first 2 weeks of campus. I hope classes. I hope that you had a really good Labor Day weekend and that we're just kind of settling in now for the semester and getting back to the business that's so important that we do. That looks like most of the questions have been answered. I think Mary's maybe sending one more. And we will also be happy to do some individual follow-up with folks as well as we get those questions in there. So thanks everybody for joining us today. We really appreciate it. And we'll look forward to seeing you all again soon. Thanks everybody.
Be safe, everyone.